Hi everyone, thanks for listening to all my presentations. Today I'll be talking about a familiar topic called Down syndrome. What is Down syndrome all about? Well, no mother or father will ever plan to have Down syndrome. At age 35 and above, mothers are more prone to giving birth to babies with Down syndrome. But from so many literatures and hospital records, that seems to be the old story. Now, in fact, mothers less than 35 years old can give birth to Down syndrome. As a matter of fact, a lot of Down syndromes are delivered by mothers less than 35 years old. Chances of Down syndrome increases with age, particularly the age of the mother. But remember, I've just said, even mothers less than 35 years old could give birth to Down syndrome. Positive family history is a chance to increase the probability of Down syndrome. Anyone with genetic translocation can give birth to Down syndrome. It occurs in about 1 out of all 700 babies delivered in the United States of America. Note this, all the factors listed above is not rigidly fixed, meaning it's just a probability. No one is sure why this disorder occurs. Now, the Down syndrome. It is a chromosomal abnormality. The chromosomal aberrations are secondary to changes in structure or changes in the number of the chromosome. The child with Down syndrome has inherited extra 21st chromosome, that is chromosome 21. The genes in chromosomes are passed to the offspring. The chromosomes are 23 pairs, with each parent donating half, making 46 in all, with the X or Y from the father or X from the mother as sex chromosomes. But here, when it comes to Down syndrome, at chromosome 21, there's an incomplete separation. Hence, the baby inherits an extra copy of the chromosome, leading to 3 of chromosome 21 instead of 2. There are different types of Down syndrome. It could be trisomy 21, and that is the most common type of Down syndrome. And that will be found in about 95% of all Down syndromes. The extra copy of chromosome 21 is found in all the cells. Let me repeat. When it comes to trisomy 21, the extra copy of chromosome 21 is found in all the cells, and that will alter all the phenotypic features that could be found. The other type of Down syndrome is mosaicism. In mosaicism, extra chromosomes is found in some cells. Let me repeat. This is different from trisomy 21, where the extra chromosome is found in all the cells. Here, it will be found in some, but will not be found in others. Some of the cells are free of the extra chromosomes. Then we're having a mixture, right? A mixture of what? Not a mixture of water and sand, no. A mixture of some cells with extra chromosomes, while some cells are having normal number of chromosomes. The symptoms here will be milder, of course. Needless to say that those cells with normal chromosome will have no phenotypic expressions, and the trouble will be less there. But the features will still be like Down syndrome. Translocation. another type of Down syndrome. Here, we have an extra part of chromosome 21. Though we will be dealing with 46 chromosomes, but 21 has been attached to a different chromosome, or it has translocated to a different chromosome. This will be found in very few cases, just in about 2 to 3%. How do we make diagnosis of Down syndrome? The first thing is to have screening tests done, but this is not fully diagnostic. We can have maternal serum alpha fetoprotein, beta chromic gonadotropin, estradiol, or inhibin. With this, we will not be able to say per se that there's Down syndrome, but that will give a clue. And we can embark on ultrasound for nurture translucency. We have to be careful with the way we go about the interpretation of these results, because nothing is definitive here. It will only give a clue. So if this is giving us clue that we are likely dealing with Down syndrome, then we'll proceed to the next level. Okay, when we have screened and it's pointing to Down syndrome, then we embark on diagnostic test after the screening test. So after a clue from the screening above, then we must check for the chromosomal abnormality. We can have chorionic villus sampling, amniocentesis, percutaneous umbilical blood sampling. There are risks associated with this test, and we carry out this test at different ages in pregnancy. At birth, let's assume you've done your screening, you've done everything, you are not sure, or you are sure, or whatever. At birth, there are certain things we can do to still give us clue that this is Down syndrome. You check the tone, there will be hypotonia. When motor reflex is done, it will be poor. And when you check the palm, there will be semen crease. That is a transverse palmar crease. The pelvic will be giving us pelvic dysplasia. The face will give us flat facial profile. There will be slanted palpebral features and hyperflexibility of the joints. When we check the head and neck region, there will be epicanthal folds, flat nasal bridge, flat face, folded ears, small ears, low-set ears, and small head brachycephaly. Still at head and neck region, we can have broad-shaped spots, protruding tongue, furrowed tongue. We may be having short neck, excessive skin at nape of neck, narrow plate, abnormal teeth, and of course we may be having hearing impairment. When we check the extremities, we can have apoplastic mid-phalanx, transverse palmar crease, like I said earlier, white space between first and second toe, short and broad hands, small pinky fingers that may be curved toward the thumb. The central nervous system may present with mild to moderate intellectual disability. Let me repeat, mild to moderate intellectual disability. A small number will have a severe disability. There will be delayed developmental milestone, though the sequence will still be the same like in children without Down syndrome. Let me explain. The time that we should have neck control, sitting, crawling, and walking will still follow in that craniocaudal sequence, but the time will be delayed. I think you got that right. The neck control, sitting, crawling, walking will still follow in that order, right? That the neck will first of all be controlled before the child starts sitting, this child will be sitting before crawling, will be crawling before walking, and so on. But it will be delayed. Intelligence will decline progressively through the first 10 years, and there could be cognitive impairment, meaning when they become adults, they will have dementia. Psychiatry. They can have major depressive disorder. Aggressiveness is found in some. Autism is also found in some cases, and Alzheimer will occur as early as at age 50. In cardiovascular system, we might be battling with atrial septal defects, patent ductus arteriosus, atrioventricular septal defect, tetralogy of Fallot. In respiratory system, we might be battling with pulmonary hypertension, recurrent pneumonia, and 60% will have obstructive sleep apnea even when they are not obese. In gastrointestinal tract, we have to watch out for duodenal atresia and Ashburn disease. In ophthalmology, they can come down with refractive errors, that is either short-sightedness or long-sightedness or astigmatism. They can have nystagmus, strabismus, and cataracts can occur in about 2 to 5% of people with Down syndrome. They are not safe from glaucoma or corneal opacity. When it comes to endocrine gland, they can have hypothyroidism. In fact, some will have congenital hypothyroidism, while the rest will have hypothyroidism when they become adults. They may come down with type 1 diabetes mellitus. Get it right. Kids with Down syndrome may be dealing with type 1 diabetes mellitus. The reproductive or urogenital system. Most females are fertile, meaning the fact that this lady is having Down syndrome doesn't mean she cannot marry and give birth. She can, most of them. Most of them will have normal menstrual cycles. They have pregnancy like any other person, and they can give birth. But many of the males are infertile. I'm not saying all of them, but many of them are infertile. So before accusing that guy with Down syndrome to be the father of that baby, you need thorough genetic testing. Criticism is common in males with Down syndrome, that is undescended testes. And with undescended testes that is not corrected on time, they are prone to having testicular cancer. And they can also have hypospadia. When it comes to hematology, they can have polycythemia, and that will be found in 60% of those with trisomy 21. There may be transient leukemia in newborn with Down syndrome, otherwise known as transient myeloproliferative disorder. They can come down with acute myeloid leukemia. Acute lymphoblastic leukemia in Down syndrome case is more than 10 times in other cases. Let me explain. Other kids can have acute lymphoblastic leukemia, but the risk of having acute lymphoblastic leukemia in Down syndrome kids is 10 times more than kids without Down syndrome. When it comes to immunity, there will be immunological impairment with decreased immunoglobulin 4. With that, there's likelihood of increased infection. Other features that you might pick is decreased weight, decreased length, short stature, and some could be obese. Behavioral. Though I've said so many things about Down syndrome, but there's one factor that I need to bring out because these people should be appreciated. They should be loved. They didn't make themselves. And we have to say the good about them. They are very, very friendly. Majority of people with Down syndrome are very, very friendly. They have good hearts towards everybody. But we should not take the advantage of these people for that. They are not found in prisons. They have good smiles. They are kind to everyone. But please don't take advantage of them. And this is one reason why all parents should be extra careful who they leave people with Down syndrome to. I mean, the caregiver they want to hire in their homes because they are friendly, they come close, they smile, they give hug. Be careful who you hire to look after them. They are not criminals. They are not found in prisons because they have good heart. They are very friendly. Treatment? No. No cure to chromosomal anomalies. But we can give supportive services to improve the life. Speech therapy is welcome. Occupational therapy could be embarked upon. Physical therapy will add value to their lives, and we can get support staff when they go to school. But let me leave a note. It's not all of them that will need school support staff. Why that? If you have followed this presentation from the beginning, when it comes to central nervous system, I've stated that some will have mild or moderate or severe disability. So we can't put all of them in one box as people who will always need support staff. Assistance to help them should start early in life. Once the diagnosis is made, we should start cooperating with the family to help these kids. With that, I've come to the end of this presentation. Thanks for listening. Remember to share this very presentation. Remember to subscribe to my channel so that you can get all my presentations immediately they are published. I appreciate it. And my heart goes out to all parents and all kids, even adults with Down syndrome worldwide. Thank you.